Hello and welcome to Mommy Dentist and Business Podcast. I'm your host, Dr. Grace Yum, and welcome back, everybody, and welcome to all of our new listeners. Thank you so much for being a part of our community and helping us be a successful podcast. This weekend we celebrated a lot of things. Friday was National Dentist Day, and yesterday was International Women's Day. A lot of great celebrations and a lot of great recognition. So I hope that everyone got a chance to either celebrate another woman that you know or give yourself a pat on the back. And speaking of celebrating other women that we know, I'm excited for our guest speaker today. She is a practicing mommy dentist, a big member of our community, and someone that I would celebrate as well. And I want to welcome Dr. Susan Jolliff to our show. She's a general dentist and private practice owner, just like many of you, and of course, an official member. Welcome to the show.
Thank you, Grace. It's so good to be here. Like you said, I'm a general dentist. I practice in a very small town in the middle of Texas, and I've been a dentist for 25 years. So I'm very excited to be here. Thank you.
No, thank you. I know that you've got a lot of pearls of wisdom, and I know that you have a lot of experience, and you could probably do dentistry in your sleep, Dr. Jolliff.
I try not to. That's definitely, I don't want to be having dreams and nightmares, although I still do. I don't know about y'all, but I still have nightmares about dental school about once a year.
Oh my
So,
gosh. Yeah, like missing an exam or not
yes,
graduating. Yes, those
yes.
recurring nightmares.
The 2 weeks before graduation, your requirements aren't done. Yeah,
Yes.
exactly.
Oh, I've had them too. I've most definitely had. Before we do a deep dive, which listeners, we are not going to be talking about dental clinic stuff. What we're going to talk about today is something very powerful. And I hope you're intrigued because this is about sharing our stories. And for all of you who know, this year our theme is share your story. Our social summit this year's theme is share your story. And it came from last year in LA, our summit in LA. And I want to explain this real quick. Share your story is our theme because of the summit last year. And that is why we're actually doing this episode. But before we get into it, besides knowing that Susan is in Texas, I'm going to ask Dr. Susan to tell everybody else a little bit about herself. So, Susan, what do you want the listeners to know about you today?
Well, just like almost all of you and my mom, I have a 19-year-old daughter who is a sophomore at the University of Texas, San Antonio, Ash. She is a public health major. She at first thought she was going to go into dentistry, but chemistry, like most of us, really hit her hard. But she's loving public health.
Good.
And I'm married to my high school sweetheart, Rich, and we're just having a great time.
I
So,
love that. I just got goosebumps, and I love to hear success stories of our community members' children and they're thriving. And wow, that is so great. Now, after the social summit, you shared something really powerful in our private MDIB Facebook community about your personal health experience. And it really
sure.
deeply impacted you. And if you're comfortable, can you take us back to that time and walk us through the what happened and
Absolutely.
how you were feeling?
Sure. So it actually all started in the airport on the way to LA. I was just walking through the airport like we were doing, trying to catch my next flight, and I was out of breath. And not just out of breath, but I had chest pain. And, all of us go through the denial, I'm just overweight, I'm 50, I'm out of shape, the whole thing. Not a big deal, right? So I just really kind of just brushed it off as that. And I went on to the airport. I was at the airport, caught my flight, and then came to the summit. But I couldn't that little naggy part of me was still there. It was like out of breath and chest pain. Okay. We'll address this later. I've got too many things to do. I've got a social summit to get to with all my great friends, and right after that I've got the American Dental Association meeting. So just kind of brush it off um, as nothing. So at the summit, I totally feel like this was an absolute God moment that God led me to make sure to listen and pay attention, and that He put these speakers there for me. Uh, one was the emergency physician who
Mhm.
came and spoke to us about, okay, who's going to who's most likely to drop and have a heart attack in your dental practice besides the patients? It's going to be us. It's going to be us as the doctor.
Mhm.
And so, that kind of put a little thing in my mind of, okay, what do you do? How would we deal with that in my office? And then the second one was Dr. Lori, and I can't pronounce her name,
Tom Coe.
Tomko Olikson. Thank you.
Yes.
And Dr. Lori came up and spoke in between one of the sessions, and she spoke about having her own experience with heart symptoms. And again, this was just a moment of, huh, total God moment.
Mhm. Mhm.
Yeah. So I went in between when I went home from the social summit. I immediately made an appointment with my PCP, and then he said, "Yeah, let's get you an urgent referral to cardiology." But then I was leaving 2 days later for the American Dental Association meeting. So I went ahead and I made the American Dental Association meeting, and the symptoms were worse. The symptoms were worse. Now, not just short of breath, chest pain, but pain radiating down my arm and
Mm.
my left arm. And so this
Mhm.
was kind of the classic, when we
Mhm.
hear about, heart attack symptoms, the pain down the left arm, the whole thing. I was watching my heart rate and I
Mhm.
couldn't get above 100 before I
Mhm.
was having chest pains.
Mhm.
So made it through the ADA meeting, went to the cardiologist. The cardiologist even was like, kind of, why are you here? Yeah, you've got a high family risk because my father had a heart attack early in his mid 30s. But your personal risk is pretty low. And she said, your cholesterol's just a smidge high, your blood pressure's up. But we're dentists, of course, our blood pressure's up.
Of course.
Um, and she said, okay, well, let's do tests. And we did a CT angiogram, which was great because I didn't have to do a stress test or anything like
Mhm.
that.
Mm.
And they found two blockages. They called me 3 hours after the appointment and said, hey, you've got two blockages that are 85%. Um, so they scheduled the heart catheterization for the following Thursday. And then that's where it got really weird and got really scary. And those of you that have read my story and heard my story, um, I walk in and I look in the waiting room, and I'm by far the youngest person
Mm.
there
Mhm.
because I was 50.
Right.
Um, and I go into the heart catheterization. They do their thing, do the heart cath through your it was through my right wrist, and they actually found three blockages.
Mm.
Two of them were over 85%, and one was, as the doctor put it, 99.99999%. So if I had waited any longer, if I had put it off any longer, there's a chance I could have dropped.
Oh
And
my God.
these were all in the left anterior descending artery, the widowmaker.
My goodness.
So,
Oh, that's heavy. And well, I wanted to rewind
hmm
because at the social summit, Dr. Steve Yoon, the doctor
hmm
who I asked to speak, he spoke for the Orange County Dental Society. So I
hmm
took his class in Orange County so I can get my CE credits for my license renewal here in California. And so when he took me through his course, and his course was on opioids, so it wasn't about dental emergencies, but I
hmm
knew that he talked about, like, he has a whole series. So then I said to him, I would love for you to come because I think one, you're a really good speaker, but two, this education is a really good review because
hmm
after a while, after you've been practicing 20 something years, you know, we know it in the back of our head, but sometimes we just need a little review, right? A little
Right,
reminder. And so and I'm like, you live right here in LA. Like you just drive over to the hotel.
right.
So he made time for us and I'm glad he did it. But
hmm
then Lori, okay, so Lori was part of our speakers workshop the year before.
hmm
And I don't know what she wants to talk about. I don't know her agenda, but she took the workshop. And in the middle of some of our breaks, I was again talking to some of the mommy dentists. And when
hmm
we have our big meetings, sometimes women like to come up to me and they tell me like this happened or that happened, right? And um, I was talking to a handful of women, Melissa Skaggs,
Mhm.
who's in Dallas. Then I was talking to Rynell, who's in
Mhm.
Hawaii. Then I was talking to Stacy Norman,
Mhm.
used to be in Nebraska, but she moved to another state,
Right.
right? Ohio.
Mhm.
And I said, all these stories you're sharing with me, you should be sharing with our community. And then
Absolutely.
Lori came up to me, and then I was like, and then she was telling me, and she's like, "Can I just share this?" And I said, "You know what? Because our social summit schedule is really tight, like
Mhm.
speaker to speaker, the program is very tight."
Right.
And I'm like, "You know what? We're making time for this. We are going to make time because these stories are so powerful, and I want everyone in the room to hear your story."
Mhm.
But Lori, so Lori went up there to share her story. And again, you don't know what everyone's going through. You're in a room of 200 people. You have no idea what everyone's personally going through. Like in
Right.
your case, you don't even know what you're experiencing. You know you're
Right.
like you're feeling these things, but you don't have a confirmed diagnosis. And so after you posted about what happened and your blockages, literally about 3 weeks ago, another doctor in our group, Dr. Missman, who lives here in Beverly Hills,
Mhm.
she shared what happened to her, which is very similar to what happened to you. And
Yes.
she said, how was it not for Lori getting up on stage and sharing it, she wouldn't have paid that much attention.
Mhm.
And then same like you, she went for like weeks. Like she'd go do her everyday thing,
Mhm.
and her daughter is a resident at the hospital, like a medical resident at the hospital.
Right.
And her daughter's like, "What are you doing? Get your butt to the ER." And
Mhm.
she was like, "Well, no, I have to walk the dog." Like she wouldn't do any of the things you're supposed to do and
Yeah.
kept putting it off. Like kind of like you were like, "Well, I still
Mhm.
need to do this meeting and I still need to do that meeting," right? She had
Mhm.
like this checklist like you did.
Yes.
And had you known that the doctor was going to tell you you have 89.9 or 99.9, whatever, you would have gone
Mhm.
straight away.
Yeah, absolutely.
You would have canceled everything and gone.
Yeah, I wouldn't have waited. I wouldn't have gone to DC. I would have, skipped all the meetings and climbing stairs and walking and all of that. I mean,
Yeah,
I could have just dropped. I
oh,
could have dropped dead on the sidewalk.
completely, completely. And she said the same thing. Sadie said something like,
Mhm.
she's like, my blood pulse, like, or pulse or heartbeat.
37?
Yeah,
Yeah.
like, hello.
Hmm.
So, what do you think it is about us women, mommy dinners, that we just keep powering through?
But I think a lot of it is how we grew up. We grew up that we had to just keep going. And, it's okay to keep going, but sometimes you just have to stop and you have to listen. You have to listen to your body. And I mean, to kind of continue my story a little bit,
Hmm. Hmm.
I listened to my body when I was in the recovery room,
Hmm.
because the my story didn't stop with having 3 stents put in that morning.
Hmm.
Um, I got sick from the sedation
Hmm.
and threw up the blood thinners that they give you
Oh,
right away after
no.
putting stents in.
Right.
And so they kept me there, and because I couldn't stop getting sick, but I kept getting pain again in
Hmm.
my chest. And at first, the nurses were like, "Oh, it's just stretching. That's normal. That's normal." But then it just kept getting worse. And finally, they ran another EKG, and they immediately, like, I start to see the cath lab people circling again.
Hmm.
I'm like, what's going on here?
Right, right, right.
And they take me back, and I didn't even make it from the table, from the bed to the table, and I lost consciousness. I passed out. I hear
Oh my
somebody say,
God.
"We're losing her." And that's the last thing I remember. And I wake up to being shocked, and resuscitated. And apparently, I lost my pulse. I went into ventricular fibrillation,
Revelation.
had a heart attack on the table. And they had to do chest compressions, shock me 3 times, and put 2 more stents in. So now I have 5 stents in my Widowmaker.
Oh
So
my gosh.
yeah,
See
so
that
just have to listen to your body and have to advocate. If they'd sent me home because I live 70 miles away from the hospital, I would have died.
you would have.
Hmm.
That to me is God.
Mm,
You know,
absolutely.
God is watching over you. I mean, over you this entire time.
Hmm.
And sometimes I think we're so hard-headed,
Hmm.
and I really think that God really wanted you to listen to those people on that stage.
Absolutely.
And it's like he sends angels to
100%.
us because I mean, unless somebody bops us over, hits us over the head with something, we don't listen.
Well, that's that I have a saying. I have a saying. It's like God whispers, sometimes God whispers in your ear and sometimes he hits you with a 2x4. And
Hmm.
luckily I listened to the whispers, but he smacked me around a little bit too. So,
Yeah.
yeah.
And that feeling is so terrifying because you don't know what's going on. And I know that you're so brave and in sharing this, but I mean, what was going through your brain? Like, were when you were trying to advocate for yourself and the nurses
Hmm.
are like, that's not like, were you kind of like, no, you need to listen to me? Or were you kind of like, oh, okay. Like what?
No, at one point I did say, no, this isn't right. I
Okay.
said, this feels like it did before the stents
Hmm.
and when I was having the episodes of chest pain.
Hmm.
And so luckily that they were listening.
Okay.
They really were listening.
I'm so glad that you did. And even though, okay, so this is where I think is interesting because as health professionals ourselves, right?
Hmm.
Like we're comfortable talking to other health professionals because we are one. But could you
Right.
imagine if you weren't one?
Exactly. But
So
yeah.
when you are sharing your stories of symptoms, and I've read and heard a lot as well that women's symptoms can appear differently. What it, because the left arm, we're taught in school, right? Like the
Hmm.
usual symptoms and the left arm pain. What would you say from what you experienced was different from what we learned?
Well, the shortness of breath was a big part of it, but I honestly think I actually had an episode of angina about a year before this. And I
Okay.
actually ended up going to the hospital and getting it checked out, and the ER doc was like, "You're the healthiest one here. Why are you here?" No heart attack symptoms, EKG was perfect, the whole thing. But in that instance, it wasn't the chest pain here
Hmm.
and left arm. It was back. It was back pain that radiated to my jaw. And that's where a lot of, from what I understand, a lot of women have that, where it's more of a jaw pain or an upper back pain
Hmm.
kind of symptom, or, chronic indigestion that just doesn't go
Hmm.
away with,
Hmm.
say, Tums or,
Hmm.
something like that. So it's quite possible I was kind of having some symptoms a year ago, either cleared and I didn't have any other associated symptoms, so nothing
Hmm.
was pursued.
Also, I wanted to add that there's
Hmm.
also, because I've been reading up on a lot about hormones, right? Because we're 50 and we're
Right.
going through it. And
Exactly.
that when your estrogen levels drop, you're more likely to have women have more heart disease because
Yes.
the estrogen isn't protecting your heart. And
Hmm.
estrogen receptors are like all over your body. And I attribute some of that to um, like what transforms in our bodies
Sure.
as we age, you know? And I think listeners, I think if you're probably in that kind of age range of hormonal changes, don't ignore the heart because
Absolutely.
that is part of the hormonal changes is also your heart. Gosh darn it, that's why we're women. We aging is not for the weak here,
That's for
like
sure. That's for sure.
God made
Well,
us women because we can endure a lot.
and for the thing like the CT angiogram that I had was so easy. Ladies, I mean, it wasn't a stress test. You didn't have to run on a treadmill until you felt like you were dying.
Mm,
It was 15 minutes, and
mm,
you had to take a beta blocker, and they gave you a nitroglycerin right
mm,
as you went in to just kind of lower your heart rate, and then they put dye in there, and just like any other CT, it was so easy. There was no craziness, and it was really, really effective in diagnostics. So if you're scared of going and having a cardiology test done and you don't want to do a stress test, see about doing a CT angiogram. It's
Mm-hmm.
great.
Mm-hmm. That's a good idea.
Hmm.
That's a really good idea. And speaking of which, this kind of triggered my memory, well,
Hmm.
me personally, and I'll share something personally about
Hmm.
myself, is after I had my second child, I developed an arrhythmia. And in Chicago, the cardiologist, well, it was never caught until I was exercising. And
Uh-huh.
I like to speed walk or do a light jog on a treadmill here and there.
Hmm.
And you know how you check your pulse? Like they always check your pulse, right? Especially if you're
Right.
taking some exercise class, they'll say check your pulse, right?
Hmm.
And then I checked my pulse, and you're supposed to hear a rhythmic beat, like a boom,
Right.
boom, boom. I was checking it because I got my heart rate up.
Hmm.
It skipped a beat. It would go boom, 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 pause,
Oh,
boom.
wow.
So I only had three beats, but and then it would pause. So it freaked me out. Went to my
Hmm.
doctor, my general doctor. He hooks me
Hmm.
up to his in-office EKG, and he pulls it up and he goes, "Did you have a heart attack?" And I'm like, "Do you think I'd be here if I had a heart attack?" And
Right.
because he's like, "This is like," he looked shocked. He looked concerned, and I'm like, "Okay, John,
Hmm.
the fact that you look concerned is making me concerned."
Exactly.
And so then I went to the cardiologist right away, and they made me do all these tests, da, 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 da. And
Hmm.
they were ultimately, they're like, you have like a negative electrical whatever in the whatever, right, in the atrium.
Hmm.
So they were like, no high exercise for a while. So
Hmm.
then they had me take home on Halterman. Did you ever do that?
I've heard of it. I've seen people wearing halter monitors and stuff, but they didn't make me do that. I was too emergent for that.
Yeah, yeah, right. So they make you wear this monitor where it's like a EKG, but like 24, 48 hours continuously.
Hmm.
But anyway, long story short is that, yeah, sometimes it's not as obvious, right? The signs aren't as obvious. It's just, for me, it was random. I just happened to check my heartbeat, right? Like
Right.
my my pulse. But I think that as women, going back to our bodies changing, our bodies do change, and
Mhm.
we just have to keep on keeping on to keep ourselves healthy. Because if we're not healthy, we miss work, our patients, the other people who work for us,
Absolutely.
are worried. Everyone in your household is worried. So I think that the takeaway here is also not just listen to your symptoms in your body, but also to be proactive.
Hmm. Yeah,
And
go to your checkups. Go, and advocate for yourself and just say, "Hey, I just turned 50. I need to go see the cardiologist for a let's do for a well woman check." Or if you have a history of it or a family history, like
Mhm,
like I said, my dad had a heart attack in his mid 30s and then ended up having a
mhm.
quadruple bypass in his 60s and et cetera, et cetera. So a very high family history of it. So if you have a high family history of it, go get checked. There's nothing wrong with it. Let them run there and get a baseline, if nothing else.
That's a great point. Get a baseline.
Hmm.
Yeah, absolutely. Well, I'm just thankful that you are here with us today. You
Me
literally, and
too.
I hate to say it, but like it almost and so I'm just like, I don't even have words right now because what you went through was so fast.
Hmm.
It just was like boom, 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 boom.
Yes.
And but you're strong and you made it out the other end. And thank God, God was with you and really sent his angels, and the whole community. We were all praying for you when you told us about it.
Yeah.
And I think going back to the community, that's one of the, I think, blessings I say about our official membership
Absolutely.
is that we do cover each other in prayer when someone
Hmm.
asks,
For
and
sure.
like, even though we may not know one another, like it's not like we would call each other and be best friends like on that level, but our community is so tight that if one of us is going through something, we all step up for that person.
Absolutely. That's one of the things that attracted me so much to our community is the support that so many of us just probably never felt, especially those of us that are a little older, older
Yeah.
dentists like
Yeah.
like me. I just turned 51 in January, and when I was in dental school, it the ladies had to stick together because
Mm,
we were outnumbered, and there were still a whole lot of old school male professors that would
yes.
call the the male student's doctor and call the female sweetie or sweetheart or
Yeah.
whatever, and you know, and now it's just so much better. But having our community where people listen to us and are there for each other, and when I posted my story, I had offers from a couple of local ladies. Do you need help at the office? Things like that. And that's so important because we need to look out for each other and we need to be there for each other. And I totally felt the prayers. I absolutely felt the prayers, and it's incredible.
It is. And I think that I want to put it out there to anyone who's listening. If you are going through something, to not be afraid to share so that we
Mhm.
can be there for you. And if
Right.
you don't share, then how can we know, right? Like, I think that's probably one thing that I want to mention. And the social summit is not just about networking. It's not just about socializing. It's not just about CE. And this is where I want to highlight for, again, our listeners, if you've never been to our social summit, this is a perfect example of how it transcends and it's more than just a meeting. I mean, if you could describe the social summit, how would you describe it?
It's almost indescribable. It feels like all of my best friends in a room together.
Yeah,
And but yet a good portion of these women I've never met in real life.
right.
And but yet you have ladies coming up to you and hugging you, and you make friends. You have random ladies that, hey, let's go to dinner. Okay. You wouldn't
Hmm.
know them from anybody, but you go, and next thing you know, you've got 7 or 8 new best friends,
I
and you're texting each other and you're calling each other, and it's incredible. It's like nothing I've ever experienced before.
Well, I am so glad that you shared this with us. And God, I think humbly reminds me every now and then. He, the message I get is, I made this group. You just happen. I just chose you to run it, but he's
Yeah,
like, I made this group, not you.
yeah,
And I get those humble reminders here and there, right?
yeah,
And I often wonder sometimes I'm like, God, why did you pick me to do this? Like, why
yeah.
me? And like,
I can imagine that.
there's like a lot that goes into it. And sometimes I'm like, in my prayers or in my like, like if I'm walking outside and I'm like, why am I doing this?
Yeah.
Like there's a thought that goes in my head. I'm like,
Uh-huh.
it is what it is now, right? It evolved into what it's become right now. But I'm like, but what happened? Like, what is going on? Like, what happened here?
Yeah.
And because people come up to me and they're like, how did you know to do this? Or like, how
Mhm.
did you know to create this business? And I'm like, I didn't. It just happened.
Right, right. It's the evolution, and it's just knowing all these incredible women in our lives that are fellow dentists that you just but it's so simple. All you had to be was a dentist and a mom. That's it.
Yep. Yep.
It's how we should treat everybody in dentistry. Are you a dentist? Yes or no?
Mm-hmm.
It
Absolutely.
shouldn't be it shouldn't be private practice versus DSO. It shouldn't be group
No.
practice. It shouldn't be faculty. It shouldn't be anything. It should be, are
Yep.
you a dentist? Yes or no? And in our case, are you a mom? And are you a
Mm-hmm.
dentist? It's
Yes.
that simple.
It's that simple. And honestly, we do have a separate Facebook group for non-mothers. But I think I got a lot of in the beginning, a lot of like negativity about like why are you excluding other women who are not mothers who are not able to. And I was like, that thought never crossed my mind, right?
Hmm.
I was like, I never did that to hurt anyone. I never,
Hmm.
but then as the community formed, I said, should we let other women in? But the
Hmm.
community spoke for itself. Like, again, I asked everyone, I'm like, and I like way back when we started, I'm like, should we have everyone join? And the
Hmm.
overall feedback was no.
Hmm.
And so I was like, okay, well, we just then keep on going on. But in the end, I do feel like you're right. It is welcoming. It should be welcoming of all dentists. And I think that some of our male colleagues want to join too for the support.
Mhm.
And I was like,
Nope.
well, yeah, I was like, well, if non-moms cannot join, then you can't join either.
Hmm.
Because the
Yep.
community said so, right?
Right.
But before I let you go, I did notice you're wearing an aura ring because you lifted
I
your
am.
hand up. Yes. How
I
has that been?
am.
How has that been for you?
I actually got it after all of my stuff happened, and I really like it. I've been wearing a Samsung watch. I'm a Samsung, not an Apple girl. And so I've been wearing a Samsung watch for many, many years. But I like the Aura
Hmm.
because it seems to give me some better insights on things. I
Hmm.
would I'm not going to stop wearing my Samsung watch because it gives me more notifications.
Okay.
But I love my Aura ring. I love
Okay.
the sleep tracking and
Yes.
um, some of the other insights it gives me. It told me before I knew it that I had the flu back
Mm.
in January,
Hmm.
and I it was right when we had a big ice storm in Texas, and it kept saying major signs, and I was like, well, I feel kind of crummy, but
Mm.
I thought maybe it was just because I was off and sleeping in, and took my temperature, and it was 101, and like, oh, that could be
Hmm.
why.
That's the reason. Well, it's funny because I've been wearing this too for about a
Mm,
year, and I do think that it gives more data. Like I don't wear the those devices on the wrist because I get too
mhm,
distracted. And I
mhm,
feel like I'm constantly doing like I'd be obsessed with it. And this
mhm.
is like you have to actually open up the app on your phone, so
Right.
there's less distraction. So I do for me and it's comfortable, but as we share the same birthday month as January babies,
Yes.
it's so our character, right?
Hmm.
To work, put our head down, work quietly. We grind and we work hard. We don't complain. We don't really open up and share with other people what we're going through. That's just,
Stubborn
I think,
Capricorns.
yeah, that's us. Like we just get the work done, and we don't even know we're sick. We don't
Hmm.
even know that we're breaking down until we have a symptom that whacks us and says, "You are sick."
Yes. Exactly. Exactly.
Exactly. So my last question of this episode is, what is your number one piece of advice on what you do to find balance between your professional and personal life?
Don't take work home. Don't take the office home with you. It's really hard. And I realize that, ladies, and those of you listening, that you just thinking, oh my gosh, the deposit wasn't as good today as it was yesterday, or I've got that terrible patient on the schedule tomorrow. Don't take it home. Don't look at tomorrow's schedule. I've stopped looking at tomorrow's schedule. I just have. It just gives me a little bit more peace at home,
Yeah,
knowing that I don't have a big gap in the schedule, or that Ms. Pain in the Butt patient is on the schedule, or whatever. I don't take it home.
I love that.
And that's I think one of the things that just I try to do, because it impacts your whole family life. Is if you bring
Absolutely.
home the negativity from the day, then you're bringing that home to your family.
100%. I love that. Very clear boundaries that you've set. Um, you know, I forgot to ask you this in the
Hmm.
episode is what do you do with the ADA?
Well, I just got off the council for dental benefits. And so I just rolled off of that this past November or
Okay.
October. And I'm currently a delegate for Texas to
Okay.
the American Dental Association, but I'm actually running for president-elect of the Texas Dental Association in May. So hopefully I'll be in leadership
Congratulations.
starting in May.
That is really exciting. I'm
Yeah,
really
thank you.
excited for you. That's such a big deal. And I know that in Texas, you guys have a really strong lobby and Texas really gets things done. And
We
so,
try to.
yeah,
We try
I
to.
know I definitely have heard amazing things. So I'm so like excited for you. That's a big,
Thank you.
big deal. And I hope you win that seat.
Well, thank you. Right now I'm unopposed, so
Oh, okay. Well, good. You know what?
so
Nobody wants to run against you.
I hope not.
They all know that you're gonna do an awesome job. That's
Well,
why.
thank you. Thank you,
Well,
Grace.
thank you. Well, thank you for coming on the show and sharing your story. And I'll see you in DC in the fall.
Yes, I'll be there.
And you know what? I'm probably gonna pull you up on stage, so get ready.
Let's go. Let's
All
go.
right, let's
To be the
go.
next inspiration for somebody to take care of themselves.
Perfect. I love it. Well, have a wonderful day and I'll see you soon.